Hello all, Ruth Dotton here. I'm a board certified adult psychiatrist who uses metabolic and lifestyle interventions to get at the root causes of mental illness. So today we're going to be talking about some situations in which special consideration has to be made before starting a ketogenic diet for mental health reasons. So this is going to include things like diabetes, kidney stones, gout, or if people are elite athletes or already underweight. Just to name a few. Okay, so before we get started, I have to make the disclaimer that we are not entering into a patient-provider relationship, and this is not medical advice. If you're at all considering entering a ketogenic lifestyle or diet for mental health or medical reasons, please consult with your medical or mental health provider to see if it might be right for you. And again, like I mentioned in my last video, because there are not standardized guidelines for a lot of these interventions in this field, you may have providers who have different opinions. So the ones that are reflected in this video are those that are my own, based on my own clinical and personal experience, as well as research. So let's get started with children and teens. So in the last video about contraindications, we had talked about how pregnancy and breastfeeding are high insulin or growth states that can provide challenges for entering into a state of ketosis. So children and teens are also in a similar growth, high insulin state. So it's important that if someone is a child and pursuing ketogenic therapy, that they're working with a keto professional to make sure that all of their nutritional needs are being met and that their growth is not being negatively impacted. Now, of course, we have used ketogenic diet in children with epilepsy for many years, so certainly we know it can be done safely and effectively, but it does absolutely require guidance and professional assistance. Similarly, we have to talk about menstruating women. So unfortunately, we just don't have that much data on using the ketogenic diet specifically in women. Some studies have shown that women who have menstrual irregularities due to metabolic dysfunction, like in PCOS, can experience a regulation of their menstrual cycle with a ketogenic diet. But for women who are already metabolically healthy, they do run the risk of developing menstrual irregularities if the body senses that there is too much stress and that it needs to go into a conservation mode. So this can happen if there's too much weight loss too quickly, or if there are intense fasting schedules associated with their ketogenic diet, or if not enough fat is consumed, among other reasons. So I could do a whole video at some point on this topic, and probably will, but suffice it to say that for those who are experiencing normal menstrual cycles, so if you're not on hormonal birth control, this can be a really crucial biomarker for health, for good hormonal and overall health in a woman of childbearing age. And so it's an important marker to keep in mind and to regulate throughout your process, your ketogenic journey. Okay. Individuals who have either type 1 or type 2 diabetes are also going to require extra close monitoring of their blood sugar levels, and they will likely need adjustments to their medication regimen, potentially really early on in treatment, as blood sugar levels can regulate pretty quickly with a ketogenic diet. And especially if they're taking medications like insulin or other medications that induce the body to release insulin, like sulfonylureas. Similarly, patients who are taking blood pressure medications, they might need adjustments really early on in ketogenic therapy, because as your body adjusts to this new metabolic state, your blood pressure can decrease really quickly. Additionally, patients who have a history of bariatric surgery and gallbladder disease also may need to make some modifications to their approach on ketogenic diet. And that's because the anatomy of their gut has been permanently changed, and they may be having difficulty producing and storing and utilizing enough bile to properly break down the large amount of fat that is required on a ketogenic diet, either from dietary fat or from your body. And these individuals, they may benefit from a slower transition to a ketogenic diet and gradual increase in the amount of fat consumption to allow their bodies to adjust. Now, there absolutely have been individuals who've had these procedures done and they're able to be successful with a ketogenic diet, but it just may take a little bit more time and caution. So another situation in which we may need to proceed with caution is in individuals who have cancer. However, at the same time, there's also evidence to show that metabolic interventions like ketogenic diet or extended fasting can actually be really helpful in battling cancer. The idea that you're essentially starving the cancer cells. But that being said, it's really important to speak with your oncology team about any dietary or other lifestyle interventions that you're considering taking on, and to see if that might be a good idea for you in your individual situation. While it's absolutely possible to maintain or even gain weight on a ketogenic diet, in most cases it does require careful meal planning and tracking of your macronutrients and calories, and just a general energy consumption to make sure that enough fat is being consumed in order to achieve these goals. So that being said, additional supports like a keto dietitian or coach or other professional are recommended for individuals who are underweight and need to develop a plan with the goal of maintaining weight. And I'm talking about separate from an eating disorder. We talked about that in the contraindications video. Not that every eating disorder is a contraindication, but underweight anorexia is a contraindication. Additionally, elite athletes, they may also require adjustments to their ketogenic diet. So although some athletes do say they perform better while they're in carbohydrate burning mode, others certainly do report achieving their fitness goals while they're in a keto adapted mode. And athletes can often consume a higher level of carbohydrates and still remain in ketosis due to their body rapidly consuming the carbohydrates through exercise. But each individual is so unique. And so again, I do recommend working with a keto coach or dietitian or other professional if possible, because it can be tricky to have that balance between the patient's athletic goals and staying in a state of steady ketosis. Another condition that can require some special precautions is gout. Although ultimately the ketogenic diet is helpful for gout, as flares are often triggered by high amounts of protein, refined sugars, and alcohol, all of which are either moderated or avoided completely on a well-formulated ketogenic diet. During the keto adaptation phase in particular, there can be an increased risk of gout flares. And that's because the ketones are competing with uric acid for excretion in the kidneys. Once through this phase, however, generally flares are pretty controlled or even improved on a ketogenic diet. But it's important that an individual is taking their preventative gout medications like allopurinol or an NSAID during the keto adaptation phase and working with their medical provider. Another potential risk with the ketogenic diet is that of developing kidney stones. And so extra precautions should be taken in individuals who have a history of kidney stones or if they're on medications that may increase the risk of developing kidney stones. So the ketogenic diet induces a mild acidotic state, which can result in the loss of salts and minerals via the kidneys, which are then excreted in the urine. So anyone who's been on a ketogenic diet knows that you're going to start diuresing, meaning peeing a lot really early on. And so that can lead to crystals building up in either the kidneys or the bladder, which can eventually aggregate to form stones. So this risk can be mitigated by aggressive hydration, particularly during that keto adaptation phase where you're diuresing a lot. And then, of course, like I mentioned, there are certain medications that do increase this acidic state, and that's how they increase the risk of forming these kidney stones. So medications like topiramate or zonisamide. So it might be worth considering if there's an alternative medication that could still meet your needs, or if you could decrease the dose to the lowest effective dose, of course, in conjunction with working with your prescriber for those medications. Additionally, there are some supplements that can increase your risk of kidney stone formation. So things like vitamin C as well as calcium. So I would advise avoiding these, especially unless you've been advised by your medical provider to take them. But if you are at all at risk of developing kidney stones and you're trying to pursue a ketogenic diet, I would avoid these. Other things that can help mitigate risk is engaging in regular exercise along with your hydration. Hypothyroidism is another condition that must be monitored closely on a ketogenic diet. It's been demonstrated that the active thyroid hormone levels decrease in a state of ketosis, But the TSH, which is the thyroid stimulating hormone, those levels actually remain normal. And this is the hormone, the TSH is the hormone that tells the body that it needs more active thyroid. The fact that it remains normal would suggest that the body has sufficient active thyroid for its needs. And so it's been suggested that the ketogenic diet actually increases thyroid hormone sensitivity, meaning that you need less active thyroid hormone in order to meet your metabolic needs. So that being said, if you develop symptoms of hypothyroidism, things like depression, low energy, hair loss, cold insensitivity, weight gain, decreased appetite, while you're pursuing a ketogenic diet, this does not mean that you have more sensitivity, increased sensitivity, with the free thyroid hormone. You should definitely be working with your provider to address these symptoms. And if you have any pre-existing thyroid condition, please work with your healthcare provider to regularly monitor your thyroid levels, particularly as you adapt to ketosis. Okay. So that was a lot of information and just a cursory overview of a lot of different conditions or situations that may require some special consideration with a ketogenic diet. So please, if you have any questions at all, please put them in the comments below. And thanks so much for taking the time to listen to this video, and I hope to see you in the next one.